Alright guys, I don't know if this is going to help, but I created a quick 8 diagnoses for sacral diagnoses. On the side, I know it's a little overwhelming at first, but here are the 8 diagnoses with their planes of axes. It gets easy if you look at just the colors one at a time, so that's what we're going to do. So the first one is a left-on-left sacral dysfunction. As we know, that's more often a physiological dysfunction. With the left on left, you're going to have a seated flexion test on the opposite side, which is on the right side. A spring test is going to be negative because you're not going to have any problem springing their sacrum or allowing it to move into flexion. The sacral base is actually going to be deep on the right side, and their inferior lateral angle, or ILA, is going to be back on the left side. So taking a look at that, if we look at just the red lettering here, you can see that the axis of rotation is on the left side, as you can see right here. Left, 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 all the way down the left side. And the sacrum is actually rotating about that left axis to the left. And the way we know that is because you see the top right corner of the sacral base, the circles mean deep. In the bottom left corner of the sacral base, the square means shallow. So you have a left axis with the left rotation. If we go back, you just flip it for a right-on-right diagnosis. And as we know, like I said before, if you have a right rotation on a right axis, that means that you started off with a left-seated flexion test. A negative spring test, again, because this is a physiological diagnosis and because you're not having any problem flexing the sacrum. Your deep sacral base is actually going to be on the left, and your ILA is going to be on the right. Your shallow ILA will be on the right. So as you can see, it's the exact opposite of a left on left. If you look at this, you can zero in on the blue ink, diagnosis number 2. Here's your right axis. You have a deep left corner and a shallow right ILA. There you go. Now it's pretty simple too. Then we go back. These two are what we like to say pathologic, but that might not be the best way to describe it. You can also describe it as backward torsions, and that's a little bit better because with backward torsions you always remember that you're going to have positive spring tests. So when looking at these patients, if you have a right rotation on a left axis, or ROL, again, you know that if you're visualizing the sacrum, it's going to be rotated to the right, but still on a left axis. And since we know the axis is always opposite of the seated flexion test, it's going to show you that there's a right seated flexion test. So we start off with a right seated flexion test, a positive spring test, because this is a backwards torsion. If you're visualizing a sacrum rotating right, that top left sacral base corner is actually going to be going deeper, and vice versa. The ILA on the right side will actually be more shallow. And that's exactly what that yellow ink is showing you. Zoom in and look at that. You can see your left axes. One thing I forgot to mention at the beginning, remember that axes are always decided by the sacral base. So you're always looking at the top part of the sacrum, and whichever axes we're naming it for will be piercing through the top part of the sacrum. So with this yellow ink, the top part of the sacrum is showing you, or the sacral base, it's piercing through the left side, so you know it's the left axis. However, because there's a deep left ILA, let me just go ahead and pick the right color here. You have a deep left ILA, bottom left corner of your sacrum, and a shallow right sacral base, you know you're rotating to the right. And that's exactly what our third diagnosis down here is showing us. A right rotation on the left axis. Just like before, the next diagnosis is the exact opposite. So you have a left rotation on a right axis. So we just flip everything around, remember, because it's still a backwards torsion, you have a positive spring test. But if you imagine your sacrum rotating to the left on a right axis, you can see that you're going to have a deep right base and a shallow left ILA. You can see that right here. Diagnoses number 4. A left rotation on a right axis. And again, you can see deep on the right and shallow on the left ILA. Now that we're past all of the rotations and torsions, we can focus on the other 4 core diagnoses of the sacrum: the right flexion, right extension, bilateral flexion and extension. These are a little bit easier. All you got to do is remember that whether you're talking about the base or the ILAs, typically we talk about the sulcus and the sacral base. It's going to be coupled, so the motions are going to be the same on both sides. So with the right flexion, this is actually a unilateral diagnosis. You're going to have everything. When we think about unilateral diagnoses, just remember everything the same. So unilateral diagnoses, everything's the same. If you have a right unilateral flexion, then it's going to be a right seated flexion test is positive. The spring test is actually negative here. And the reason for that is because you're having no problem moving into flexion. You're having more of a problem moving into extension. So your spring test isn't going to tell you much. It's just going to say, hey, it's already, the sacral base is moving into flexion. We already knew that. So right unilateral flexion, think about using the palm of your hand and the top 4 fingers pointing down on the right side. Or let's say just your index finger and your middle finger pointing down on the right side. Okay, well, we know that means that the sacral base must be deep on the right, and the ILA is actually back on the right. And the reason for that is the curvature of the sacrum. That shows you that when the anterior part of the sacrum is moving more anterior, the posterior part's moving more posterior and shallow. So if we look at that purple ink right here, you can see that the purple ink is actually showing you just along the midline here. There's no axes of rotation, so to speak. There's just the midline purple line, and there's a there's a deep sacral base on the right side, indicated right here by that purple ink, and a shallow ILA on the same side. It's a little bit easier to see in 3 dimensions, but just remember the sacrum is a little curved and the motion's coupled, so when you move forward anteriorly at the base, you're actually moving shallow posteriorly at the ILAs, or the inferior lateral angles. A right extension is just the opposite, so you're extending fine. Here your spring test is actually going to be positive. Make sure you take note of that. And the reason your spring test is positive is because it's going to feel like a brick wall when you're pushing back on that sacrum and doing your spring test, because it doesn't want to move into flexion. That's the whole point. So in this situation, you're unilaterally, the gray is what we're looking at, you're unilaterally actually going to be shallow on the sacral base, and you're going to be deep at the ILA. Unilateral extension. And of course it's the same on the left side. Bilateral flexions and extensions, probably pretty easy to write out the diagnosis, kind of harder to be comfortable making that diagnosis, so beware of that. Most of us are going to have a left on left or a right on right rotation, so when in doubt, go with the left on left or a right on right. Bilateral flexion tests, you're going to have a seated flexion test that gives you no information, because guess what? Both sides of the sacrum are flexed, so neither one is going to be moving more or less than the other. Your spring test is going to be negative because your sacrum's having an easy time moving into flexion. The hard time is moving into extension. Which side's deep? Both of them, obviously. Because when you look at this, you can see that we're looking at the orange ink now, both parts of the sacrum, of the sacral base, are moving into flexion at the same time. Go back, bilateral extension, it's the exact opposite. Neither base is deep. Actually, the ILAs are deep. And then you have a positive spring test. That's the big difference between a bilateral flexion and extension. With the bilateral extension, you have a positive spring test, because both of these on the sacral base, both sides of the sacral base are shallow. Remember, the squares are shallow. meaning that you're having a hard time moving into flexion. And that's what this pink picture on the right side of the graph is showing you. It's showing you that you're further extended than you want to be normally. That about does it. To summarize, left on left, right on right, most common diagnoses. A right on left or a left on right are backwards torsions, a little bit less common and they're considered pathological. A right flexion and a right extension, those are that should say unilateral flexion and extension. And remember, just the same letter all the way across. Same letter all the way across. Bilateral flexions, they both are deep and both ILAs are shallow. Bilateral extensions, the sacral base is not deep on either one because you're coming back, you're resisting flexion, but your spring test will be positive. Okay, hopefully that helps. Good luck.